COVID-19 has had a huge impact on colleges across the country. Most, if not all, colleges and universities, including the University of Dayton, sent students home to finish their semesters remotely in March 2020. This fall semester really varied, from some universities staying fully remote to many doing a hybrid of online and in-person or hybrid classes, which is what UD did. We are a residential university and our students have a strong desire to be present as a community. So our challenge was how to do that as safely as possible. Testing, a strong on-campus case management and contact tracing team, isolation and quarantine, all have been important parts of our plan. We had some bumps, but managed to keep students on campus as planned through the week of Thanksgiving, and students finished classes remotely. One of the most important factors was that after an initial spike in cases, our students really came together to support each other in wearing masks and following social distancing. Following the safety protocols made a huge difference. I've worked with college students for a long time, and they often consider themselves totally invincible. The sad truth with COVID-19 is that this virus can be dangerous to everyone. Unfortunately, UD lost a first-year student after he went home to study remotely, was diagnosed with COVID, and passed away. I can't imagine the heartbreak of that family. They remain in my prayers. It's really important for everyone to remember, vaccination against COVID not only protects the individual, but also reduces the ability of the virus to circulate. This protects everyone else in our community, which is particularly important for those more vulnerable or those who can't be vaccinated. A college student getting his or her COVID vaccine not only protects themselves, but their parents, their grandparents, their little sister or brother, their cousins, their neighbors. It also protects the business owners and their employees who desperately need our support. I would add that the safety of the vaccine so far looks very, very good. The risk is very, very small. The risk of not getting the vaccine is allowing the pandemic to continue with its devastating effects on the health and lives of individuals and the tremendous secondary effects on businesses, our health systems, individuals' financial situations, and our economy. Get your vaccine. Yes, until a significant proportion of our population is vaccinated, the virus will continue to circulate and put others at risk. So masks and social distancing will continue to be important measures. But with wider vaccination, this will reduce the ability of the virus to spread, which should reduce risk and case numbers. We will continue to work with Public Health Dayton and Montgomery County and our medical advisory panel to determine how and when to reduce those precautions. At UD, the Student Health Center does not normally charge a visit fee, so students won't need to worry about cost. Other universities use an insurance-based model, which can be an impediment. If students are struggling with the potential costs, they should reach out to their health center or Dean of Students office to see what type of supports are available. Most universities do have systems in place to help. It's really important for college students to look for resources that are reliable to learn about COVID vaccines. The CDC has excellent online resources. Immunize.org is another great resource, obviously focusing on immunizations, including COVID-19 vaccines. And of course, public health departments are important sources of reliable information on vaccination and COVID-19. Most importantly, students should continue to wear face coverings and observe physical distancing in the near future until vaccination is widespread and risks are low.